exposed with regards to seeking the parent's attention, with regards to making demands, with regards to pointing, with joint attention, because if mutual regulation is not there because there's no shared activities, there's no external regulation from the parents, then we are already starting with a problem, because you'll see after when I talk about the different profile that will lead to beginners, novice, and expert. So mutual regulation that need to be asked with regards to parents. What did they do daily when it came to play, when it came to sharing moments, when it came to exposing them to different environment, and what was their roles? Because the parent is supposed to be the model at first, because they will develop with the child what we call intentional attention. So the more the parents points at something and gets the child's attention, the more the child is already starting to regulate, meaning stop where they're looking, where they're paying attention, and start, sharing moments. So that's what shared activity means. After that, hopefully the child, by the time he gets into the school system, that the parents, they've started working on self-regulation itself. For those of you who know, because I've worked with you, or you heard me before, self-regulation entails self-control. So did the parent, with their discipline, with the work and to true play or expectation, did they teach their child how to um, work on self-control, meaning that is the child capable of stopping himself or herself and then adapt their behaviors with another adults, with multiple children, and also with within different environment. After that, we're talking about emotional regulation. I think where we went wrong, we're trying to teach kids to express, name emotion. That's the level 4 with emotional regulation. The first two is the parent is supposed to identify how their child reacts, their emotional response to different stimuli, different people, different environments. So these are key factors, because the school should be working on self-discipline, meaning that the school should be working on giving the child the proper tool to engage behaviorally, to engage emotionally with high motivation, and then engage cognitively, meaning I'm able to learn. So that's really, I wanted to start with that because I get that question all the time. I did videos yesterday for 2 boards with regards to the parents, and we did talk about the role of parents with regards to self-regulation. So when the child does learn a skill for the first time, it's really important that the social context is taken into account. If they've learned that at home, but they never go to the park or they've never been exposed to other children, it will affect the profile that you'll be getting in the school. And also, that will also play a big role with the differentiating between a child that is able to communicate and a child that's not. So that's the key element to start with when we were talking about self-regulation. What did the parent teach the child? When we look at self-regulation within the competency level, what should we be looking at in the school system? We should be looking at behavior regulation. So does the child know the expectation? Can the child clearly demonstrate behaviorally that he understands you? When you ask him something, when you ask him to share a moment, when you ask him to, come near you and all that, does he do it? Joint attention, I'll talk a bit more about it because that's key in child development. People that don't work on that, I don't understand how they can move on to communicate. Social interaction, both expressive and receptive language, emotional expression, affective relationship, so building trust, and being able to share moments with other children. Gesture imitation, not just imitation of behavior, but using gesture to communicate with an intention. Vocal imitation and private speech. These are the key domain that anyone that tells me they're working on self-regulation while using play, these should be all the competency that you're looking at. where we start, because everyone that knows me, I've been working so many years of trying to identify what's the difference between a beginner student and a novice student and an expert student. For this level, what I'm talking this morning, we're talking about the attachment component. So the attachment process in early emotional regulation is key. It does tell us if a child will be capable to perform in a classroom, to perform within a group, to be able to transition into the school setting and trust an adult. So early parent-child attachment is also telling us later functioning. So if the parent is overbearing and overprotective, then this insecurity means that the child risks having social anxiety, having separation anxiety. So that means the cognitive image that the child has when the caregiver is not there, it's really built on fear. It's not built on trust, and it's not built on learning opportunities. So such representation for a child will guide them into their expectation about their own emotional responding. So that's when you get a child that keeps crying. That's when you get a child that starts throwing stuff. That's where in a child you say no, they go flip-flop on the floor and they start reacting. These are children that lack the basic competency for self-regulation. So they don't know how to self-control. They don't know how to modulate their emotional response. So the experience of the caregiving lead to secure attachment. So when we're asking about the ECE or the teacher in the play base, so the expectation of the emotional need has to be taught, because many kids are coming in the system, they've never learned. They've never learned to respond to another child. They've never learned to compete for the attention of an adult, because at home they either have control of the environment or they don't have to ask, because it's always the parent that anticipate. Anticipation is the key factor for cognitive development. Any child that cannot anticipate will not learn how to play, will not learn how to process transition, will not learn how to shift their attention from one aspect, one activity to the other. So secure children are these children that are coming in with low stress levels. So when we say, if you look at Dr. Shanker, when he went on and talked about self-regulation is a child that's really capable of being calm and awake, meaning motivated, he put a lot of emphasis on the stress level. So a secure child is someone that can transition from home to school or being on a bus and transition all through the. An insecure child will be based on the distress level. It's not just, oh, he's anxious. That child is also in distress. So the more they are in distress, that means they can't calibrate between their behavior, their emotional reaction, and that means they don't have any opportunity to learn. So the cognitive is the last component of engagement. So if the child does not engage behaviorally and emotionally, well, good luck. He's not learning anything. He will just maybe imitate, and he'll stay probably to parallel play or just manipulation of object. So that's really important. And then you get these disorganized children coming in where they get mixed message about everything. At some point, you feel that their progress is wow. And then, 2 days after, you see the same child. And then I get these comments, well, he's regressing. He's not learning. He knew that 2 days ago or last week or 2 weeks ago. And all of a sudden, it's not happening. Disorganized children are incapable of managing any types of change, managing any new routine, managing any new knowledge. So if you change the play areas, or if you change the topic or the team that you're dealing, disorganized children, they always want stuff to be the same. So that's why if you're the type of person that keep having a rigid routine, it's not going to help these children, because they become dependent on routine. As soon as there's changes, then it affects their development. So the attachment component of emotional regulation and the autonomous, we are supposed to be helping these kids to become independent. So that's part of self-regulation. So any child that is not at the secure level, so the first few weeks when they get into the school environment, that's what we need to be assessing. When we say that we're going to be working on self-regulation, you need to be able to identify the type of attachment. That's like, I'll give you a different example of, that's like the child that hardly knows anybody and already goes to the adult and starts grabbing the adult's arm and then walk around and always hides behind the adult. That's an insecure child. Sometimes people find that, cute and all that, but that child that needs to always be behind the adult to explore the environment is in major trouble. So the secure child is the one that will take initiative. It's the one that will, be able to play for more than 5-10 minutes. And it's a child that, will share moments with other children without having to run to the ECE or the teacher all the time. The disorganized one, it depends because they are more what we call the novice students. Because the disorganized, they do have competency. But at the same time, if there's too much change, if the routine changes too much, if there's new objects, new toys, if they're placed in another group, anything that really is not pre-programmed, that means they can anticipate, they will react strongly to it. Avoidant children, and that's the sad part, avoiding children are usually the one that eventually will end up with a form of diagnosis because these children, they display a lot of lack of competency coming in. They have a lot of problems maintaining the emotional regulation. They have this internal arousal all the time, and so they react impulsively. They will avoid, so runners, for example, they'll get out and start running in a hall because of it. So again, that profile is usually our beginners. They avoid new situation, they avoid new children, they avoid new adults, they avoid new environment, and they will behave in a way that's communicating to us that I'm not capable of staying within this environment. So again, when you compare the avoidant child to the secure child, you're able to see that the avoidant child usually will start to repress everything. And so they become the passive aggressive child or just a passive where they don't engage. They become more of the observer through play. So they'll be there watching, but they don't engage themselves. And as soon as an adult or another child comes in or, comes in, then they'll just get out of the secure child will stay there, will share, and will be able to look and change and adapt their behavior accordingly. So school-age children, the ambivalent resistant attachment early on will predict internalizing symptoms. So when we're talking about self-regulation, when I followed children for 3 years, I realized that young girls and young boys will express self-regulation issues differently. So boys, it's always external behaviors, but where we're seeing with ambivalent and resistant kids, it's also internalizing symptoms. Then they'll be stressed, they'll be anxious, they'll do nail biting, they'll play with their hairs. As soon as you want eye contact, they'll avoid eye contact. You call them, they're not sure, they're confused. You see them, you watch them, they start walking, and all of a sudden they stop and they're confused until they're re-engaged by an adult or prompted to do something else, then they'll do it. The avoidant attachment profile and the disorganized one, they predict internalizing symptoms too with self-regulation. So that means they lack self-control and they lack emotional regulation. And then you have the beginner type profile, what are called the resistant. And so what happens to them is because they don't learn the competency, and once they get to the teenage years, so as with hormonal change and everything, a lot of them often are diagnosed with anxiety disorder because they lack the skill, they can't control themselves, they can't regulate their emotion, and unfortunately, cognitively, they're not there. So that's where a beginner, novice, and expert child starts. It starts at home with the type of attachment they had. It also pursue itself when they get into your class, and how they interact with the environment, the other children, and the adults. And so attachment really plays a big role early on, and that's when we see it. And I'll be talking about different profile in another context, but these are the early elements. So I think it's our job to assess the level of attachment and see where these kids are. So when we talk now about stages of play, because self-regulation is one aspect, behaviorally and all of this, but there's also the different stages of play of kids coming in. The different stages of play, so different periods, depending on where the child is and how he gets to the school system. There is, often people are, saying, oh my God, he's still at the, solitary play phase. If that's the case, it gives you the maturity level. It gives you where the child is with regards to learning and also with regards to socializing with other kids. So that the child that always plays alone with his specific toys, and then from those children that are, at close proximity, is a child that's incapable to engage and disengage. It's a child that has, joint attention issues. And so that means that they can't do more than one thing. So if they're fully engaged with some toys, that means they will manipulate that object, that toy. They might do a little bit of playing. There's no imagination. There's no real, constructive play. It's just that they're just standing there. So it might be because socially they're anxious. It might be because emotionally they are afraid. And it might also be that cognitively they can't share moments with other children because they're not there with their play. Then you have the onlooker play, and that's the child that keeps watching other kids playing. So they stand or sit within speaking distance, and they might talk sometimes, but usually these kids are not playing at all. We tend to see more young girls do that when we look at self-regulation compared to young boys. But, onlooker play profile, they do exist, and it's something that we need to address. Either they don't know how to integrate a group, either they don't know what to do with the material, either they don't have imagination, or either they're just too anxious to even ask to play with other kids. So that's the two first levels. So if you look at beginner and novice, usually we see them there. So they're more into solitary play and onlooker component of it. Then when you see novice are those that are starting to do parallel play. So they will play independent with toys, but they'll make sure that socially they sit close to other kids, and it doesn't bother them. They might even peek at what the other kids are doing, come back to it. So that means already for us, it's a great skill because they're able to engage in what they do. They're listening. So that means they're able to discriminate other stimuli, go back to it, look at it. They might smile, come back to it, and it's just they don't have the social interest at that point. So that's more of a novice type of play. They don't mind having kids close to them. They don't mind looking at what's happening around them. They might imitate. So they might just be in the imitation phase of their play, but at least they're getting there. Then, really, what we should be seeing in the school system, and that's why I put different ages in bracket, it's what we call associative play. Associative play, it's once the child has graduated from parallel play, and that child all of a sudden is capable. If you put a table and then you have 4 kids around the table, they will share the material, they will start talking about it, they will start talking out loud, they're engaged in whatever they want. So they're capable of getting within the group, that should be around age 3 to 4. So when they get into the system, hopefully they were, highly stimulated at home, and they've went through the different phases of play by the time they get, honestly, I got to be honest and transparent, a lot of kids coming in, I see a lot of still onlooker, and I see a lot of parallel play. And I've seen that for 2 years with the same child, even though he's with or she's with the same group. So associative play, it's when you're capable of really evaluating self-regulation, because they can self-control within the group. You know that they can also uh, regulate their emotion, they'll share, and so there's not going to be I'm tapping you on the head because you took the toy. So they're really in tune with what's happening, and that's where we start seeing self-discipline, because they engage behaviorally, they engage emotionally, and they engage cognitively. And then you get into what we call cooperative play. And that's usually between 4 and I wrote 6+, because for me, play should be also in grade 1. So cooperative play would be, up to grade 2, where the children are working together in an organized group with designated roles to accomplish a common goal through play. So that means you're really aiming at cognitive abilities, executive function abilities. So you're talking about organization of material, organization of thoughts, able to plan how you're going to play, so the procedure of it, able to choose the best strategy to do that, flexibility, meaning capable of stopping yourself, listening, and then readapting your behavior. So that's where really we're talking about executive function with cooperative play. Constructive play is then when we learn about attributes of different material, engage for curiosity and imagination, and experiment. So the kids, they really want to try something new. They have a plan, they have an idea, they'll say it out loud, and then we strongly encourage them to do so. And then, so that's the real emotion. Then the physical play, but the kids are doing that from early on up to elementary school. That's the way. It's where they have physical play activities, going to recess and all that. But I think what we need to keep in mind is kids need to understand and learn about sequence of action. To kick a ball, what does it entail? To any type of play, then it does entail physical activity, but we need to also be looking at how do we teach them the procedure so they can do it independently and address the needs. Expressive play, you see where we're talking way further down, when we're talking about role playing, when we're talking about putting the children in front of the puppets and trying to create scenarios and all of that, and expressive their emotion through play. It's really at a high level. That means the behaviorally they're okay, emotionally they've learned theory of mind. So that means they've learned that other children have different emotion, that other children have different interests in them, and that now they can decode the nonverbal in children's emotional response, and they'll adapt themselves. So that means you can really play a character, and you can be Batman if you want and all of this, but then that means we're talking about expressive play. So that's really taking to a higher level with cognitive abilities. So if we're talking about immature play, for example, I've just put a few examples for everyone to understand the difference about immature play versus mature. So if we look and do observation, immature play, for example, would be the child that constantly repeats the same action, cut up vegetable or wash dishes and the little kitchenette there, and that's every day, that's all he does or she does, compared to mature play when they've gone to another level. So the child will have a scenario in his mind, and then we'll play a scene created out of the material. So learning and using play, it's not just the ability to manipulate object or to imitate action with object, it's also to create through imagination different scenarios with regards to it. So that means the child, once the child is capable of staying more than 5-10 minutes, and they can continue after recess, and the next day they're still on the same scenario, that's mature play. the child uses object in a realistic manner, it cannot invent accessories, then the child would do so. So child play does not involve any role playing or involve only rudimentary role playing, then compared to a child that's mature, would use more specific characteristic of the rules of the game, will play multiple characters, will change the language, will change the action. The child will assign a role to an object, then speak and act on behalf of that object. So they're able to also transfer an object into something real. The child makes little use of language compared to the child that uses dialogues. And I'll talk about private play, um, private speech because of it. So I'll wait till I'm there. And then other example, the child has arguments with other kids with regards to toys. A mature, expert would, be able to look at the disagreement and really invent accessory rather than fight over them. So he'd be able to, self-control and then just either share, just explain or express himself emotionally in a proper manner, not punch them or push them or go to the adult and start crying because they want the adult to solve the problem. If a child does that, ask yourself where they are with their development with self-regulation. That means they're into the intentional regulation, meaning that's the adult that's doing the job for them. So any child with an EA early on, tell yourself that that EA is doing the self-regulation for the child. That child is not learning, is just learning to imitate based on the prompt of that adult. So when we talk about joint attention, we're talking about a child that's able to share intention with the adult. In school, that means that the imitation involves not only coping with the physical action, but also being able to do relevant inference about the intention behind the action. So what a child is unable to do at this stage is to comprehend and reproduce an adult's intention when she herself is the object of the adult's attention. So when we talk about joint attention, we're talking about the ability of a child to walk towards the adult, tap on their shoulder or tap on their arm, point to something else. So that means the child is looking at you, will disengage and look by pointing at something and will get your attention there, and then the adult will respond based on the learning opportunity that's there. If the child does not have that, then tell yourself that this child is not in no way communicating when they go to you. If they grab your hand and they bring you somewhere and they don't look at you, they don't share, and there's no intentional attention sharing, he's not learning joint attention. That means don't ask why they don't socialize. Don't ask why they don't integrate groups. And so don't ask why when it's carpet time or whatever you're doing, that this child will not look at anybody, will not engage with anybody, and will not be able to discriminate the information because they don't know how to do that. So it's more than just imitating behaviors. It's imitation based on inference, meaning that there's an intention to get the adult or the another peer attention. So, and this is where a lot of professionals, they go wrong with the interpretation of what we call proto-imperative and proto-declarative's intention. A child may first express a desire for an object with a proto-imperative pointing gesture. I've been working for 25 years in autism, and I can tell you right away that 99% of the time, an autistic child will develop what we call proto-imperative pointing. He's using you to get what he wants. So that type of pointing, that type of action is only when a child needs somebody else harm or because they need to reach somewhere. So there's no real intention shared with an adult. So that means the child is not learning to point. There's no real nonverbal gesture. It's just gimme, 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 gimme. So it's to fulfill a need. When we're talking about engaging with other people in a shared or joint attention, it's when the child is into what we call proto-declarative pointing gesture to get the other person's attention. So they're pointing at an object that they want to share that moment. So if they're looking outside, they see a bird and they start, wow, and they look at you and they point to the bird and then they go back at you to make sure that you're looking at it. Then the adult goes and says, wow, it's a bird. And then the child might imitate the word. And then you both look at each other and you smile. That means that's proto-declarative. That means the child was communicating something with you. Just think of all the kids you've been working with where they're using way more proto-imperative. Any child that has control at their home will use proto-imperative because they're controlling the adult or other kids to get what they want. So there's no communicative intent. So children are also, they need to learn to point, private pointing, and they also need to learn private speech. Private pointing, because each time an adult talks, keep in mind that a child has to discriminate between two elements that are very important. One is verbal and the other one is visual. So when you're pointing to something and giving them a prompt, you're asking the child to be capable of listening and also looking visually, so the visual memory will take a snapshot of what you're pointing to. So, but what we know is most of the kids that commit a speech gesture mismatch, we need to rely more on gesture than their words. They are not capable at that point to have both competency fully developed. So children are 90% more capable if they learn to point, if they learn to use gesture before they start discriminating verbal prompts. So the pointing gesture is among the last communicative gesture to appear in early childhood. My question to all of you, do you measure that? Are you looking out for that? If you're not, you should, because the correlation between pointing and naming might be a byproduct of social mediation. So the more a child points, the more the adult provides him or her with opportunities to learn new words. If they can't point, you can tell vocabulary words every day. You can do the ABC, backward, forward. The child will not learn if he doesn't know by association, pointing at each letter, what it means. So pointing is such a key competency to have. So the presence of private pointing in 2 to 4-year-old children expands the phenomenon of pointing far for self well beyond infancy. The fact that an intellectual difficulty triggers the use of pointing for self is a robust proof of its adaptive use. And then the selective efficacy of pointing linked to how challenging the task is for the individual children also supports its intellectual function because pointing is related to both cognitive demand and with task performance. There's also what we call now private speech, and you'll see the impact of private speech. And now we need to stop telling children, shh, quiet, and all of that. They should be talking out loud when they're playing, because if they don't learn private speech, they won't learn executive functioning and problem solving. So that private speech is a cognitive ability that will lead to metacognitive competency eventually. It starts at the age of 2 and it grows stronger until it peaks at 3 and 4. So that means your age, and disappear around the age of 10. So private speech represents children's capacity to verbally mediate their own thoughts and action. So that means it's increasing self-awareness. The more they talk out loud, the more they're aware of what's happening around them. Identity formation, that means that they're talking to oneself about what they're going to do through play. It's a voluntary control of action. The more they talk to themselves, the more they're able to self-control and use the adaptive behavior. If they can't self-talk and they become impulsive, they'll act on every stimuli, and that gets them in trouble. And it's also self-speech is also, private speech is the capacity to motivate a course of action toward a goal. So if he wants to build a tower, the more he talks about how he's going to, do the tower, how many blocks he needs, and how he's going to do it, that tall, or not that tall, the more he does that, the more he's motivated, and the more he's planning how to reach that goal of having his tower and having success. What we see with regards to private speech, after doing that for so long, it helps adults know the child's developmental level. So children expressing thoughts that are in their heads, because otherwise I don't know how you can do it. The child's frustration or confidence level, private speech in relation to a child's frustration, when they start talking aloud, being mean, and all of this, or expressing how angry they are, and their confidence level. If a child is upset, he will engage in more private speech. So they will say bad words. They will impulsively start saying, this is stupid. I don't like that. I don't want to do this, and all of that, because they're not having any success. It's typical behavior. So private speech as being typical behavior in children of this age, it's just what they do naturally at that age. We've gone away from that skill, and it's unacceptable. We need to promote private speech. It also helps us understand when they retreat or avoid. So children engage in private speech as a way to avoid a task. So if they don't understand, then they might start, people sometimes think it's echolalia. They might start, babbling and all sorts of things, but it also leads to the best skill that anyone could have, and that's problem solving. So, having said all of that, now you know about the role of parents. Now you know about what we need to be working on, the competency. You know about the different level stages of play. Now let's look at behaviorally what it looks and what we should be looking at. The 4 phases of behavioral change in any human being, but most importantly for little kids, is the ability to take initiation, continued response, maintenance, and habit. So behavioral initiation, it's the decision of a child to put the effort to initiate a behavior, a new pattern that you're teaching them. This is what we call initiation response. So if the child understands what you're expecting of them and they take the initiative to change their behavior, you can already say Yahoo, because that means the child understands and he or she already sees the benefit of taking that behavior. Where it gets really problematic is how the adult responds to it, because after that, what we call continued response, it's the level of effort that it takes to manage these new behaviors when they're faced with overexcitement, when they're faced with activities they don't like, when they're faced with an adult asking for something they don't like. Then this is where we get into the continued response phase. If they're not motivated or if it's not worth it, then usually that's where it ends. And that's what people start saying, well, he was able to do it, and now all of a sudden 3 days after it's not doing it. Same thing with using reinforcement. The reinforcement is for the first phase. You've been taking initiation, but then to continue the effort that it takes, both socially, emotionally, and cognitively, what is the child getting out of it? And do you understand? Behavioral maintenance, it's when children choose to maintain a pattern of behavior based on repeated assessment of that behavior. So what it means for us, practice, 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 practice every day. Once you introduce a new skill, you should practice many, 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 many times a day. So it's a phase in which children continue to maintain the behavior, but without having to think about it. That leads to what we call habituation. And that's where we want to bring these kids, where they don't have to always think about, choosing the best behavior, that they've learned about it, they see the good in it, and then it becomes an habituation, meaning they'll just use that behavior without having to think. The more you think about something, the more draining it is. So the maintenance phase is characterized by the desire to sustain, the new pattern. So children feel less the need to verify their ability to engage because they know it. The decision to continue becomes less of a function of a child's ability to perform because they see the value of doing it. And the children complete the shift from focusing on what they expect the behavior to afford to what the outcomes is. So that means it becomes an habituation. Excuse me. So how children think about the behavior may shift as they habituate to the pleasure associated with their new experience. Unlike the prior two phases of the behavior change process, children can remain in the maintenance phase indefinitely. It's not all kids that get to the habituation level. So the transition to habit is really occurs when children are no longer actively concerned about that ability. They're able to engage in the behavior, they're able to evaluate the outcome and change their behavior if needed. So that means they also develop flexibility, they've also developed judgment, they've also developed what we call the ability to shift and that means disengage and engage in other behavior based on the environment, the person, and the activity. So these children will continue in this phase until an extent of sufficient magnitude causes them to reconsider. So that means if we're not consistent with our expectation, then we lose a lot of kids with regards to behavior because they say, well, with Stefan, it's like that. With Kim, it's like that. Well, I'll go back to the old behaviors. It's way easier. So it's to remain into the habituation is asking consistency from adults. The bottom line, when we know that children are able to self-regulate, it's all related to self-efficacy with regards to behavior change, with regards to emotional regulation and cognitive ability. Self-efficacy, it's when the child knows his strengths and weaknesses. He's capable to self-monitor. He's capable to self-manage and will adapt and monitor his and modulate his response behaviorally, emotionally, based on any situation that happens in front of them. So the predictive value of self-efficacy, just think of yourself as an adult, because self-efficacy also includes us with our knowledge, with our competency, is a shift as children move from initiating to maintaining a behavior. Once children have shown that they can manage their behavior, then they will decide to maintain it on their willingness and desire to do so. So finally, here are the main effects of play on child development. So play creates a zone of proximal development for several domains of intellectual. Play facilitates the separation between thought and action and objects. Play facilitates the development of self-regulation. Play also influences motivation, and play will facilitate cognitive decentration. Thank you.
Well, thank you very much, Stefan. Certainly gave a lot of content in a very brief time. I can see people writing. So I think that met that objective of knowing those key indicators, those look-fors in our learning environments related to play. Certainly underscores and really highlights the how important and valuable and needed the work and the setting that we have in giving kids those opportunities to learn through play, and how valuable that can lead us to building those very valuable skills of self-regulation. So there's 3 questions here. One, is it
Okay.
possible to get a copy of the PowerPoint? I can answer that. Yes.
Yes.
So that'll be on eHub once we get through today. So because we have 2 other sessions, one's around diving more into the beginner of the profiles, and the other one's in metacognition. So it's nice overlap if any of you are participating in that. Next is we do have a kindergarten team that really engaged in that social checklist, that project. Not that project, but the social checklist. They found the one that basically
Yes.
mimicked what we had done at Pope Francis, but another team had taken that on. Question is, if they did that in October, how often should they be? Should they do a repeat now, or just once, or just at the end? What do you suggest?
Well, I think that's a great question. Thank you for the team to ask it. I think when it comes to competency, the working memory, the way it works is if you introduce something. So if you've worked and introduced that survey in October, the child, depending on how often he practiced, that would stay for about a few weeks. Now I think we're in March. That means would be a proper time to reassess to see if where the kids are. Are they in the maintenance phase or are they into the habituation with regards to their behavior, with regards to their emotion, and also with regards to play? I think that would really, because after a few months, you'll know if the child really learned or was he just imitating based on trying to please the adult.
Perfect. Thank you. Next question, we have if a child suspected, let's say, to be on the, with autistic traits, they have great difficulty accepting when other children are using toys or items outside of what they see as their intended use. How do we help that child understand that they are using their imagination and that it's okay to use the items in a different way?
So I think that that's an awesome question because, like I explained before, especially when it comes to autism, they don't develop joint attention. So all they do is they imitate. It's called echopraxia. They'll just imitate and look at the object and all of that. So whenever somebody else starts using imagination and all that, they see social injustice because they weren't expected that somebody else could use the object in a different way, giving it a different meaning. That means anyone that works with any population with regards to autism, no matter what age is it, they need to anticipate. So I would anticipate before by putting an object there and asking any kids. So the prompt would be, okay, so now look at all the object, and then I would ask any child to take the object and imagine something else, give it another function about it and all of that. Hopefully the child with autism would develop imagination and we would know because if he goes and gets the same object that the last child used and says the same thing, it tells you that he has no understanding about using inference and using imagination. So any time you work with autism, you need to anticipate before what the rules are because they react mostly because it's not rigid. It's not, following his or her rule. And that's why they react strongly with regards to that. They might even take the object or hit another child or get into a meltdown because they are not used to changes. So they do everything by association.
Perfect. Thank you. Those are actually the only questions, although I'm sure if we unmuted everyone, there'd be lots of other questions. So guess what? You have time to sneak one more in. I don't know if anyone wants to raise their hand really quick.
Kim, it's Amy at St. Pat's. Can I ask a question?
Of course, go ahead, Amy.
Hi, Stefan. I have a little boy that has difficulty following the end of day sequence of events. So we've been front loading that for him, helping him do the first few jobs, and then he completes the rest of the jobs. But sometimes, so yesterday he was completely dressed, saw that his lunch kit wasn't in his backpack, got completely undressed, put the lunch kit in the backpack, then got redressed because he was out of sequence.
Yeah. So that's very important what you just said. So I think it's called behavior rehearsal. So that's the best strategies for that. You always need to teach every action that's needed with regards to dressing up, making sure your lunchbox is in your bag, and we're making sure all of this. So you need and I want to also congratulate you because you're using chaining. So to teach them the sequence. I think what's important is that needs to be included somewhere within putting the lunchbox in his bag. So maybe it's either you start with that and then you move on to, because the fact that he at the end decided to undress and do that, that means for me in his mind, the logical sense, because autism, that's the way they work in a systemic way. So either at home or somewhere else, they probably do it the reverse, and that I would go with what the child gives me. So I would put the full sequence from top to bottom, and then include maybe lunchbox in the bag, and then put the bag somewhere, and then dress, and then whatever else is happening.
We do have a visual that the children all look at for the sequence of events to help them get their things done. I'm just curious as to why he would have gotten completely undressed to do that one job and then redress.
Because when you put visual for the entire children, the entire children are using visual as a reference. A child with autism will use a task analysis as a cognitive ability. So that child would need to have the strip in his own hand to put it either wherever, and then start, as soon as he finishes an action, he needs to take it off, because you're teaching him a cognitive sequence. Other children, they're just referring to them, and okay, I need to do this, I need to do that. Completely two different skills, and completely two different function. So that's why he did undress, because when you put it for the entire group, first of all, the ability to look at it, do it, disengage, re-engage in that for the next step and do that would also create confusion, and they often will become disorganized. They need to have it in their hand. They need to cognitively, plan it with you in anticipation before. Today, what do you want to do, Stefan? You want to put your lunchbox in your bag first and all of that. You put the image there. He should be able to do it, and then that means cognitively, this is at that moment his decision. He's taking initiative, and he needs to do it that way. It's a cognitive tool for a child.
So that shouldn't be corrected. He should just be allowed to undress and then do it in the
Yeah, I think what you mean, and I fully understand what you're saying. It's not the fact of correcting it. I think it's the fact that there were two different perceptions. For the adult is, why did he do that? He was already there. He only needed to put his lunchbox in his bag. For the child with autism, once a sequence is not the way that he anticipated it, because he forgot a step, that was already in his mind, he needs to go back to the beginning. That's what autism is all about. That's why if they can't complete an activity, they will have a meltdown. Even if you say after recess we'll continue, they don't have the ability to stop there and say, okay, this is the next step. They need to restart from the beginning, and that would explain that behavior of undressing and redressing with everything else.
Okay, thanks very much.
Perfect. So I think that's about it for time, folks. I certainly want to thank you for taking your time this morning, for joining us. Hopefully it met some of your learning needs. And again, yeah, so we'll have the slides on eHub for you, so you'll be able to refer to them, just to consolidate some of your notes as well. And we want to thank Stefan for his time and for sharing his wisdom and knowledge. I love it. I have little hands. All right. Have a great day and enjoy the rest of your learning today. Take care, folks.
Keep up the great work, people.